Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Michelle Wargo. We have lots of important health information to share in this month's episode. We'll turn our attention to healthy bones and joints with insight from a local orthopedist and a delicious recipe from the Conry Creation Health Center kitchen. We'll speak with a Mount Dora gynecologist about menopause treatments that meet an individual woman's needs. And what you eat may put you at risk for painful kidney stones. You'll find out more. We begin with a disease that can affect everyone, young and old. And living here in Florida puts us all in greater danger. Because our climate encourages us to be outside more, doctors want you to be aware of the potential for skin cancer.
All skin cancers are related to skin damage. Mostly in Florida, it's the ultraviolet light that comes in with the sunshine. Skin cancers, we'd like to think of them as both melanoma skin cancers, which originate within the melanin cells. Those are the cells that give you the skin tone, the color, and non-melanoma, and those are the most common. And most people know that kind. They're both basal cell and squamous cell. The non-melanoma is usually benignish, meaning usually you can pick them up early. They're the skin nodule or the abnormality on the skin that's irritating to look at, but it's not really painful. Sometimes it bleeds a little bit. It grows very, very slowly. The melanoma kind, on the other hand, is the more aggressive, more dangerous, because it has a propensity to grow fast and at the same time spread to other organs, and that's really where the problems lie.
Richard Conger of Eustis noticed a discoloration on his ear and sought answers immediately.
Well, I set up a regular scheduled meeting with my dermatologist because I do work out in the sun. And I showed him an area that I was a little concerned about, a little white area in here. And my ears started to crust up when the sun got too big, you know, like scab. And it was starting to worry me a little bit.
Mr. Conger's dermatologist confirmed that the spot was skin cancer and discussed treatment options.
Skin cancer's treatment varies by kind of skin cancer, but for the most part we'd like to remove them, especially at the early stage, because that prevents the worsening or progression. Now, removing them sometimes is not just with a knife with a surgeon. Sometimes it's with radiation that you remove them. Those are typically cases where surgery would leave a deformity or a scar that the person does not want to have, or the melanoma or the skin cancer in general is in a place where surgery is just not very feasible.
Radiation treatment was the option that Conger and doctors decided to pursue for his skin cancer treatment.
It was probably over a period of a month. I'd come in and they'd set me up on a table, block everything with, so radiation just concentrated here. And in a couple minutes it was over. You know, it was very quick, very painless, and enjoyable.
Even after treatment, skin cancer survivors must be diligent.
Recurrence for skin cancers is a really important thing. Think of it this way. You are the same you. Your skin is the same skin. And I think you haven't changed your residence. You still live in Florida. And so you still have plenty of skin that has been exposed to sunshine and sunlight that can have a chance of developing skin cancers. We usually recommend all skin cancers, that's both melanoma and non-melanoma skin cancers, to have a very close follow-up with their dermatologist.
I'm cautious. I make sure the sunblock thing every time I go out. And even if it's overcast, I'll put it on. And like I said, the broad brim hat. And if it's really, really bright, I may wear a long sleeve shirt, you know, to cover the color of my arms and stuff. But it makes me, you know, I'm very aware that, you know, I can come back or I can have more trouble.
You can find a specialist to help you with any skin cancer concerns by visiting the website fhwaterman.com. We now turn our attention to kidney stones, a common condition that can affect people of all ages. Kidney stones form when urine contains too much of a certain substance, causing crystals to develop into stones over weeks or months. You may not have symptoms until the stones move down the urinary tract and, in some cases, cause excruciating pain.
Kidney stones are a very common problem. It affects men and women of all ages, even children. No one is really immune to the formation of kidney stones. It's especially more prevalent in the south and the warmer regions because the most common cause for kidney stones is dehydration.
Drinking plenty of fluids every day is the best way to avoid kidney stones. But Dr. Gerbach says other foods in your diet can be a source of the problem.
There are a number of factors that lead to kidney stones. In some patients, it's uncontrollable, like genetics. But for others, it's simply dehydration, their salt intake, both in their diet, as well in the foods that they eat on a regular basis, their meat intake, and when I refer to meat, I mean all meats, red meats, pork, chicken, turkey, even eggs. Any animal protein may increase your risk for kidney stone production.
If you suspect you have a kidney stone, contact your urologist right away or visit the website to find a specialist right here in Lake County. There's no question that the temperature is warming up as we get closer to summer. But some women in our community are feeling the heat even more dramatically. Menopause is a natural aging process for women when ovarian function begins to decline. Yet each person experiences the timing and symptoms differently.
The most common complaint that we hear about menopause really is that the 45 to 55-year-old with having irregular bleeding, whether it's spotting or not. The second most common is what everybody hears about actually, which is the vasomotor symptoms, hot flushes, hot flashes. Some women, their hot flash, their skin temperature actually does change up to 7 degrees very suddenly, and it can happen within 30 seconds to 5 minutes. It doesn't go away sometimes for 5 minutes to 30 minutes. And this thought that, oh, this is only going to last 2 years is not true. Some women have it for some reason their entire life.
Dr. Pillow says some over-the-counter supplements and prescription medications can help.
I started getting hot flashes, and he told me to start counting them. And so I was counting at least 10 to 12 a day, and that's when I was awake, and I could remember to write them down. But they were just unbelievable. And then at night, I was having trouble sleeping. And so because I've had breast cancer and it was estrogen responsive, I could not have estrogen to help my hot flashes. So he had put me on Lexapro, which I did have some moodiness, so that wasn't going to hurt to get on that. And then that didn't work by itself, but he put me on Megace, which the combination of two it helped my hot flashes.
Hormone replacement therapy is another treatment for menopause, but Dr. Pillow says it comes with controversy.
Estrogen replacement therapy really is the best treatment for a lot of the things, the vasomotor symptoms that occur particularly. The progesterone is added. They found many years ago that estrogen alone does stimulate the endometrial lining, so it can induce endometrial cancer. So they added progesterone to help prevent that. The drawback to that is some women will start cycling again, and that's kind of a nuisance. So it's a dilemma as a physician doing hormone replacement to try to tell someone it's open-ended. There are dangers. It has been shown to be associated with breast cancer.
Dr. Pillow says there are lifestyle changes a woman can make to help with menopausal symptoms.
One, getting as close to an ideal body weight as possible and maintaining a fitness and being mindful of what you eat, because we talked about some of the triggers. The other is don't smoke. That's one of the triggers. It's very common. You're taking something heated in. When you are, be mindful of your environment and those types of things. So if you're feeling warm, have a cold drink. A glass of ice water is an easy way to kind of combat some of that.
You can find a gynecologist to learn more about treatment for menopause by visiting the website on your screen. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. We'll visit the Conry Creation Health Center kitchen to learn a health benefit of eggs. A local specialist talks about advanced treatment for a painful joint disease. And you'll hear from 2 local doctors who have the recipe for staying active for your age. Visit watermanwellness.com for a complete listing of the specialists featured in this episode. And you can register to have Waterman Wellness magazine delivered to your home address. Now, Waterman Wellness has information about local health events you might want to put on your calendar. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Michelle Wargo. We know exercise is important for everyone, but how you approach it can be important as well. Waterman Wellness got input from 2 local specialists about what's appropriate for young children and for senior citizens.
There's several ways you can keep your child active and safe this summer, and if you stick to 3 basic rules, you should be okay. Number 1 is give your child at least an hour of exercise per day, and you can do that all together in 1 hour, or you can break it into short sessions. Second rule is limit screen time. Make sure that you limit TV, computers, video games, all these things. Actually, the American Academy of Pediatrics suggests that you limit 2 hours of screen time per day in a child 2 years and older. And then the third thing would be just good nutrition, just making sure your child eats plenty of vegetables and fruits, and avoid fast foods, and keep your child hydrated as well.
Exercise has multiple benefits for healthy aging, according to the doctors, yet some types of exercise are better contributors to a good quality of life.
The more exercise you do, the more better you feel. Exercise also strengthens your gait and balance, so exercise is also known to reduce your risk of falling. I would encourage my patient to do any type of exercise they could. There are a variety of regimen that you can use, so not to do it on your own, or utilize your primary care doc to clear you. Some of you may have chest pain, some of you may have COPD. The regimen that you need to embark on have to be approved by at least your primary care physician. So if you are quite weak and debilitated, swimming certainly would be something you think about. Stationary bike, or even simple walking with a pair of comfortable shoes. If you're younger, enjoy activity, I'd say Pilates.
For some people, just about any activity can be difficult because of a painful disease called osteoarthritis. Approximately 27 million people suffer from the disease. Most often are older members of the population.
Osteoarthritis is where the joints deteriorate over time for a variety of reasons. They can deteriorate from routine wear, an injury can occur, or you can have over 100 different types of diseases can cause osteoarthritis. These things can exacerbate if you're overweight osteoarthritis, but it's not preventable. It's equivalent to tires on a car. Over some period of time, there's going to be some natural wear.
Osteoarthritis is most commonly found in the knee, but can affect other joints such as the hip, shoulder, and even your arms.
It's a wide variety of treatment options. Obviously, it depends on what stage you begin to address the arthritis. It can be treated with anti-inflammatories, weight loss, some of the over-the-counter anti-inflammatories, some people, the omega-3 tablets. Those things you can catch early stages, and then late stages, obviously the end result, you may end up having to treat with a full knee replacement. But there are several new treatment options in the middle. So for instance, if you have isolated arthritis to one localized area of the knee, you can do what's called a macoplasty, or a resurfacing procedure. And those procedures do not require replacing the entire knee joint. You're just replacing a small surface area or a part of the knee, whether the inside part or the lateral part, and most of those patients can be treated on an outpatient basis.
If you or a loved one suffers from joint pain, you might want to consult with a specialist. Visit fhwatermanortho.com to learn about local experts. Diet plays a role in having healthy bones and joints. We now head to the Conry Creation Health Center kitchen for an easy recipe that's good for your bones. Imagine having dinner ready in less than 30 minutes. Chef Dave Atkinson is here with us today, and he's going to share a light yet filling recipe with easy-to-get ingredients. We also have registered dietitian Stephanie Bassett here to tell us why it's good for us. Hi.
Hello.
So what are we making?
We have a broccoli and red pepper frittata for today.
Oh, all right. And why is that healthy?
Well, it's a good source of calcium, which helps our bones.
Okay.
It's also a great source of vitamins A and K, which help with vitamin D and calcium absorption in the intestinal tract.
Fantastic. So what goes into this?
Well, this is a very quick and easy dish to make. It's a one-pot dish. We have broccoli, roasted red peppers, onions, cheddar cheese, salt, pepper, eggs, and milk.
All right. And we're going to cook it right here, right?
Yeah, let's go ahead and put it together. We're going to start out by just sauteing our vegetables.
So that is a preheated pan.
We're actually going to do a steam saute, so we're going to just toss them in the oil real quick and then add a little water to steam.
Oh, okay.
So we're just going to steam our vegetables for a minute. And while we do that, we'll get our eggs ready. And we're just going to add the milk, the cheese,
It's a lot of cheese.
the pepper, and the salt. And we're just going to take them over to the sink and drain them off.
What's the benefit of draining it?
Just to get that extra liquid out of there.
The great thing about this recipe is that it has a lot of calcium in it, and calcium helps with our bone health, and osteoporosis causes 1.5 million fractures every year.
Okay, so our frittata's been sitting for about 10 minutes or so on low heat. We're just going to uncover it and see how it looks.
Looks good.
Yeah, it looks like it's firmed up nicely. And all we're going to do is cut it like you would cut a pie. And we'll let Stephanie give that a try.
If you'd like the recipe for the broccoli and red pepper frittata, visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the June episode right here on Lake Sumter TV for some of the following stories. A local specialist will provide insight into a dangerous arterial condition that is often overlooked. You'll want to tune in. You'll find out how treatment for irregularities available right here in Lake County can improve a woman's quality of life. And we'll head back to the Conry Creation Health Center kitchen for a twist on burgers on the grill. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Michelle Wargo for the award-winning Waterman Wellness.